Most of our DAFO customers use standard anatomical terminology to communicate their brace fabrication needs to the staff here at Cascade. This is a brief review of some of the basic terms of position we use at our facility and in our educational resource materials. Standard anatomical position for the human body is based on this model: the body standing erect, the limbs extended, and the palms of the hands facing forward. These are the terms we're going to review in this session. We will present them in groups of 4 with each term paired with its opposite. The first group includes superior, inferior, anterior, and posterior. Let's begin. Superior means higher than or above another object or location, closer to the head, up, or above. In this example, A is superior to B. A typical use of this term would be in an instruction such as add additional padding superior to the medial malleolus. Inferior means lower than or below another object or location, closer to the feet, down, or below. In this example, B is inferior to A. A common use of this term would be an instruction like relieve area inferior to medial malleolus by 1/8 inch. Anterior means closer to the front than another object or location, toward the front, front, or in front. In this example, A is anterior to B. We refer to the front edge of most of our brace styles as the anterior trim lines. Posterior means closer to the back than another object or location, toward the back, back, or behind. In this example, B is posterior to A. We refer to the flexible extension of the Dafo 3.5 brace as the posterior strut. Let's review these 4 terms. Superior is up toward the head, inferior is down toward the feet, anterior is in front or toward the front, and posterior is in back or toward the back. Let's move on. The second group of terms includes medial, lateral, proximal, and distal. Let's look at medial and lateral first. To understand these terms, you have to visualize a line drawn down the middle of the entire body. We call this the midline. Medial means closer to the midline than another object or location, toward the midline, or middle. The side of the leg or foot closest to the imaginary midline is called the medial side. Lateral means further from the midline than another object or location, away from the midline, toward the side, or side. The side of the leg or foot furthest from the imaginary midline is called the lateral side. The terms proximal and distal relate specifically to a limb, such as an arm or a leg. Proximal means to be closer to the attachment point of the limb in a direction towards the attachment point or toward the base or trunk the limb extends from. In this example, A is proximal to B. We refer to the uppermost trim line of a brace shell as the proximal trim line. Distal means to be further from the attachment point of the limb in a direction away from the attachment point or the trunk or toward the tip of the limb. In this example, B is distal to A. We refer to the brace trim lines closest to the toes as the distal trim lines. Let's review these 4 terms. Medial is towards the midline or middle. Lateral is away from the midline or toward the side. Proximal is toward the attachment point or base of a limb. And distal is away from the attachment point of a limb or toward the tip. The third group of terms includes dorsal, plantar, unilateral, and bilateral. The terms dorsal and plantar relate to the feet. Let's have a closer look. Dorsal refers to the top surface of the foot or toward the top surface of the foot. Dorsal is an adjective, so it's used to describe something such as the dorsal surface or the dorsal area of the brace. The actual name of the dorsal area is the dorsum. Plantar refers to the bottom surface of the foot or toward the bottom surface of the foot. Plantar too is an adjective, so it's used to describe something such as the plantar surface or the plantar contours. The actual name of the area is the ventrum. Unilateral means relating to one side only, one-sided, or single. Bilateral means relating to both sides, two-sided, or a pair. Let's review these four terms. Dorsal means the top surface of the foot, or towards the top surface. Plantar means the bottom surface of the foot, or towards the bottom surface. Unilateral means relating to one side only, one-sided, or single. And bilateral means relating to both sides, two-sided, or a pair. We hope this review's been helpful. Thanks for your participation.